Okay. Hi, everyone. My name is Asiana Griffin. I am a UIC occupational therapy doctoral student, and today I will be presenting a workshop called Unbound, Breaking the Silence on Pelvic Pain and Sexual Health. This is going to be for the ANRISE community. So, just a little bit about me. Again, I am a third year doctoral student in occupational therapy at the University of Illinois Chicago. I am a capstone student at ANRISE. And my capstone is about understanding pelvic floor dysfunction, increasing awareness of pelvic health to reclaim ourselves as sexual beings. And I really want to foster this healthy engagement in sexual activity and sexual response for women who have experienced sexual trauma. So, before we get started, I just want to put out a quick content note that these topics are pretty heavy that I'm going to be discussing today. They will center around pelvic health and sexual trauma, as well as pelvic pain and sexual activity. So I encourage you that if these topics bring up strong emotions, that you pause the video as needed or you step away when needed. You don't have to sit through all of it at once. You can definitely break this video down into chunks if that's needed. And I also do want to recognize that this is merely just the start of the conversation. This is going to be an overview of pelvic floor dysfunction and not necessarily, I won't have the chance to dive into each topic as and cover it in the way that it should be covered. So this is just an overview, but at the end I will release the materials that I've created that will discuss these topics more in depthly. So my only expectation here is just to be open to learning, stay curious, and stay present in the moment as possible. So my goals for today are pretty simple. I would love it if we're all able to build confidence and understanding in pelvic floor dysfunction and how it can be impacted by sexual trauma. I would also love if we can learn and understand new ways to adjust sexual activity and manage pain to support overall sexual participation, which can look like exploring pleasure, and exploring those intimate moments either with oneself or with a partner. So, I won't go too much into anatomy, but I think it is necessary to cover the basics. And we're going to start here with what is the pelvic floor. So, to the right of the screen, you have a diagram of what the pelvic floor looks like. It's usually referred to as like a hammock-like structure. And very simple, the pelvic floor is going to be a group of muscles that support your bladder, your bowel, and sexual function. So these muscles are the muscles that help you control when you go to the bathroom, and it helps support your pelvic organs. And these muscles also they also help experience sexual pleasure. So when we're having like orgasms, all that sensation down there, that is what the pelvic floor is for, and that's what it supports. So when these muscles become too tight or often too weak, or like they're not working together properly, this can lead to pelvic floor dysfunction, which is what I want to get into today. So, what is pelvic floor dysfunction? Pelvic floor dysfunction is going to be a condition where your muscles may be, again, too weak, too tight, or injured. And this can make it harder for them to relax or tighten when you need them to. And so I just want to be clear that this is not an exhaustive list. This is not all the symptoms that come with pelvic floor dysfunction, but these are pretty common symptoms. And so you have pelvic pain or pressure. So this can be short-term pain or long-term. So we might hear words like short-term being acute or long-term being chronic pelvic pain. And then you also have painful sex. And with this painful sex, it may be so uncomfortable that you may need to pause or stop. And then you can also be experiencing like bleeding during sex. Um, just because of how tight your pelvic floor may be, it may cause a lot of friction and that may lead to bleeding. And then you also have leaking urine or bowel. Sometimes this can be referred to as bladder incontinence. And then there's this other side when we go more into like the sexual activity part of it, is that we have difficulty inserting like using sex toys. So that could be wands, vibrators, any of those things. And then, or even difficulty just inserting period products. So you have like your menstrual cups, you have your menstrual disc or tampons. If our pelvic floor is really tight, then we're not going to be able to insert those period products or those sex toys as often as we could. And then there can be a heaviness in our pelvic floor, which can lead to like us being able to like urinate very often. So we may have very frequent trips to the bathroom, or just like all in all bowel discomfort. And then going back to the sexual side of it, just more so like fear or difficulty orgasming, which basically we if that's happening, we are gonna not spend as much time having sex because it's uncomfortable for us. So overall, with pelvic floor dysfunction, this can lead to decreased sexual activity and this can lead to an increase of pelvic pain. So, how does sexual trauma affect pelvic floor dysfunction? I just want to be very clear that this responses to sexual trauma can look different depending on the individual. So, this is not, I'm not saying this is everyone's response, but this is just sort of how a timeline could go. So, the sexual trauma event occurs. And from there, our body starts to store a lot of tension and fear in our pelvic region, in our pelvic area. And so your body is naturally going to try to protect you. Our body is naturally going to develop what we call protective responses, which is naturally just muscle guarding. And with muscle guarding, this can look like a lot of pelvic tightness or maybe trouble relaxing our pelvic floor muscles. So our body's naturally going to guard us because this traumatic event has occurred. And this can happen without us even realizing it. We may never realize it. I think one thing that I thought of about this is that you know how like we clench our jaw like naturally or we walk around with our shoulders raised up and then we're like we don't even realize it because it's become like a natural state of like tension for us, like a stress. It's like almost like a stress response. And then sometimes you have to just put your shoulders down or you have to unclench your jaw. That's just like my little analogy for it. And so this can happen, these like this pelvic floor muscle guarding. So this tightness in the pelvic floor, this tension can happen without us even realizing it. And it also can happen years later after the sexual trauma experience has like occurred. So this can happen this can come on the onset of this can happen years later after this traumatic event has occurred, which is also I think a key thing to realize because it may not happen right after. You may be experiencing pelvic pain 5, 10 years later and you're like, where's this coming from? I'm not sure. And so with this pelvic floor muscle guarding, you may develop some symptoms that are consistent with chronic pelvic pain or pelvic floor dysfunction. So the symptoms that were listed in the previous slide, those may be the symptoms that you are experiencing, or you may be experiencing something else because again, that was not an exhaustive list. That was just like the most common symptoms that women were presenting with when they were going to the doctor. And so through this, sexual activity may start to feel uncomfortable or there may be an increase in pelvic pain. So in the beginning, it could have been acute, so it could have been like that short-term pelvic pain, but now it's like chronic, like over years, over months, over weeks. I have been experiencing pelvic pain, so now it's turned more into a long-term or what we like to call chronic pelvic pain. But again, this timeline is just a general timeline. It's not everybody's case. So, the impact of sexual trauma. One thing that I do want to point out here, this is sort of the timeline, the same timeline, honestly, but it's basically that sexual trauma changes how our body responds to stress. So, this can lead to different pelvic conditions. And again, these are just a little bit of the condition. So this can lead to muscle tightening. This can lead to pelvic organ prolapse, chronic pelvic pain, so that long-term pelvic pain, or painful intercourse, which is like the painful sex. It can be the bleeding during sex, the fear or difficulty orgasming, all of those things basically. And this is because sexual trauma changes how our body responds to stress. Now we're muscled, like now we're tightening or we're having trouble, difficulty relaxing our pelvic floor muscles. And so now we are experiencing symptoms that are common with these pelvic conditions that I have listed here. And so, how does this affect our life overall? How does this affect our everyday life? It affects how confident we feel during sexual activity. It affects our ability to enjoy sexual pleasure. And it also affects how comfortable we are with oneself or with a partner during sexual activity. So, in the end, if we are in a relationship or if we have just a sexual partner, this affects how we are having intimate moments with our partner. So, in turn, this can affect us across our lives, basically. Sorry. Okay, so this point is just a interactive element. I'm still going to keep it in this video. So this is going to be myth or fact. You can pause the video as you go through it. I'm going to start with a scenario and then you can pause and I will give the explanation if it's a myth or a fact. So the first one is I can only go to my gynecologist if I'm experiencing pelvic pain. Okay, so this is actually a myth. There are tons of healthcare providers that can help with pelvic pain. This is just a few that I'm naming here, but a pelvic floor physical therapist, a pelvic floor occupational therapist, mental health professionals. So you have like psychologists, you have counselors, you have therapists, you have urogynecologists, and not mentioned here are also like sex educators, sex counselors, sex therapists. So there's tons of people that you can go to. You don't just have to go to a gynecologist if you're experiencing pelvic pain, but you can also choose to go to them if you like. So our next one is that pain during sex is normal. Is this a myth or a fact? Okay, this is a myth. While common, pain during sex is never normal. If you are having pain during sex, it may be beneficial to seek out any of those professionals that I've listed before that are trained in pelvic floor. So moving on to our next one, it's going to be if I have pelvic floor dysfunction, Kegels are the only answer. Is this a myth or a fact? Myth. Kegels aren't always an appropriate treatment. Okay, so basically, if your muscles need to relax or lengthen, um, rather than strengthening them, you may need to do other versions. So, like you have Kegels and you also have reverse Kegels. This is why I cannot stress this enough. It's so important to go to a trained healthcare provider. Because they're going to be able to guide you to what exercises that are beneficial to you and what and your body. And so I would say that oftentimes we do hear Kegels, 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 but sometimes it's like you may need to do reverse Kegels, depending on your own body. And so that's why I cannot stress this enough to go to a trained healthcare provider in pelvic floor health because they are going to be able to guide you to the necessary treatments and exercises that are beneficial to you and your body. So we have like two more, I believe. So this one says pelvic floor dysfunction affects both men and women. Is this a myth or a fact? This is actually a fact. Pelvic floor dysfunction can impact anyone. I know it may not be talked as much within like the male community, but I do want to emphasize that it is both. It can impact both men and women. Pelvic floor dysfunction is not even talked about nearly as much in the within like amongst us women. So I do recognize that it isn't spoken about within the male community, but I do just want to emphasize that it can impact anyone. And last but not least, we have one more. Let's see. Only older adults or women who have experienced childbirth have pelvic floor dysfunction. Is this a myth or a fact? So this is actually a myth. Pelvic floor dysfunction can affect people of all ages and backgrounds, including those who have never given birth. So again, pelvic floor dysfunction can affect anyone, and we know that this is a myth because we it can affect anyone in the case of like sexual trauma as well. So you do not have to give birth to have pelvic floor dysfunction or to have symptoms consistent with it. It can impact anyone. And so thank you for that interactive moment. We are going to move forward into our content. So we learned what pelvic floor dysfunction is. We learned what our pelvic floor looks like. So, and we learned how it is affected by sexual trauma. So what can we do to treat this? So this is, again, it's not an exhaustive list of everything we can do. I just want to touch on some main things that can provide both physical support and emotional support. So the first thing I would say is adaptive sexual activity strategies. So this can look like supporting your body. So mainly your belly and your back. And this will change like with pillows or cushions to change the angle of like the penetrative moment. And this can improve comfort. This can reduce pain. So just basically different body positioning while you're having sex, different sexual positioning will help to increase pleasure in the moment and decrease pain. So we use this with pillows or cushioning to provide comfort. The second thing I would say is using sex toys and lubricants to increase pleasure and decrease pain. In my project deliverables, I'm going to go into detail about what type of lubricants to use, what type of sex toys to use that are the best for our bodies. But basically, we can use these toys and we can use these lubricants and incorporating them with either solo activity or partner activity to decrease pain and increase pleasure. And then I would say the biggest thing during those intimate moments is to communicate with your partner. It's really important that we are talking about our comfort levels, that we're discussing our boundaries. Maybe we have a safe word we want to use when we feel pain and we want to stop. I think it's really important that if we are doing any partner activities, that we are communicating where we are so our partners know, our sexual partners know that this is what feels good. Hey, this doesn't feel good, or hey, I might actually need to stop. In my deliverables, I have some key like conversations and words and phrases that we can use when discussing things with our partner, because it may be very uncomfortable to speak with someone else and say, hey, I actually have a lot of pelvic pain, or hey, I'm actually very afraid of having an orgasm, or those things can be very challenging to say to someone else. So later on there will definitely be material presented where we are navigating those conversations. And then the second thing, more so on the emotional support side of it, it's going to be your mindfulness and deep breathing. This is like really important. Taking those slow, like deep belly breathing to relax our pelvic floor muscles. Because as I've stated previously, that there could be a lot of muscle tension and fear stored in our pelvic region. So it's really beneficial, like before intimate moments or after intimate moments, to take that time to relax our pelvic floor, to ground ourselves again. And we can even do this with gentle stretching and relaxation exercises. And also, if you are seeking that trained pelvic floor healthcare provider, they may be able to provide some guided exercises that you can do before those intimate moments to really help you ground yourself, reduce your pain, relax your pelvic floor. So you're able to engage in those intimate moments, or you're able to engage, like even just sitting for a long time sometimes can cause more pain on our pelvic floor, can put more pressure on our pelvic floor. So it may be useful to do those exercises before, just if we have an office job, it may be useful to do those pelvic health exercises before work or after work to really reduce that pressure and tension on our pelvic floor. And lastly, but like not least at all, is that we need to seek professional help. We need to, like, if you are experiencing a severe amount of pain or if you need more guidance, I recommend just going to a trained pelvic floor healthcare provider who can give you the guidance, who can give you the treatment options, they can give you the exercises needed. They can really help coordinate care for you and refer you to all the possible healthcare providers that you would need on your team. So when I'm saying who are these trained pelvic healthcare providers? 'Cause I know I've said that a lot, but let's get into it. So I've broken it down into physical support and emotional support. So with our physical support, we have gynecologists. Again, we are very familiar with them. They can address any reproductive and pelvic health, sexual health concerns. So this can be our first go-to. Anyone on this list can be your first go-to. It's just a matter of where you feel that you need the most support. And so then going right into it, we have pelvic floor occupational therapists. So with pelvic floor occupational therapy, therapists are going to actually help to support your daily living. So they're going to be probably incorporating more of those adaptive sexual activity strategies. They're going to be showing you maybe let's use these sex toys, let's get into this lubricant. They're going to focus on the body positioning of it all. And then they might even throw in some guided exercises to help you before and after. Um, they can even recommend things like let's maybe do some more grounding beforehand. Let's maybe do some like warm baths or stuff to just reduce that pressure, to relieve some of that pressure in our pelvic floor region. And then we're going to go into pelvic floor physical therapists. So, pelvic floor physical therapists, they are going to provide those guided exercises to help you strengthen or relax pelvic floor muscles. Oftentimes, they would say the word like lengthening our pelvic floor. So yeah, they're going to provide those guided exercises that are going to help either strengthen or relax our pelvic floor muscles so we are able to engage in sexual activity and find it to be very pleasurable and be able to enjoy it. And then we have our primary care providers, which are just our regular doctors. We can go to them. They can help screen and they can help coordinate care. So maybe they can refer out to a pelvic floor occupational therapist or a pelvic floor physical therapist. Or if you need more of the emotional support, they can refer you to a psychologist or a sex therapist. Going to them can help coordinate care because often with pelvic floor dysfunction, you're going to have a team around you. There's going to be a team, a pelvic health team that is supporting you. And then we're going to move into a urogynecologist. The difference between a urogynecologist and a regular gynecologist is that urogynecologists diagnose and treat more pelvic health conditions. They have a little bit more. They're a little bit more specialized in pelvic health. So that would just be the main difference between the two. And so on the flip side, we are going to go into emotional support. So seeking out a mental health professional, like a psychologist, a counselor, or a therapist, they're going to help provide some of that emotional support, stress managing strategies, and coping mechanisms. This is really important, especially if you're dealing with pelvic floor dysfunction in the context of sexual trauma. It's going to be important to be backed by that emotional support, to have someone to rely on for those stress management strategies. Because like often, like I said before, many women there's a lot of tension, there's a lot of fear, there's like a lot of emotion stored in our pelvic floor. So it's going to be beneficial to work with somebody who's helping, who's addressing that stress management, addressing those emotional concerns. And then we also have sex counselors and sex therapists. So they are going to be focusing on supporting that sexual pleasure and intimacy, either with yourself or with a partner. And so our sex counselors are going to focus more on like that sex education, while a sex therapist they can dive more into the therapy side of it, going into like sexual trauma as well. But both will be able to support sexual pleasure and intimacy, just depending on your needs. You may prefer one over the other. And again, I just want to mention that treatment for pelvic floor dysfunction often includes both the physical support and the emotional support. So you may have a pelvic floor physical therapist on your team, but you also may want a regular therapist on your team. You may want like a mental health therapist on your team, just because so oftentimes, like I said, especially in the context of sexual trauma, these things can be overlapping. So while we do have physical concerns that we need to address if our pelvic floor is having trouble relaxing or is tightening or it may be a little weaker, we want to address that we want to address that part of it, but we also want to come in and address the emotional side of it and figure out how do I get up every day and still do this? How do I get up every day and still live my life and I'm experiencing all this pain? Or how do I go back to enjoying sexual activity with my partner? How do I go back to enjoying sex with my partner and I have chronic pelvic pain, you know? So I think it's really important to address both sides of it. And so, as we wrap up, I just want to get into some key takeaways. That if you are experiencing pelvic pain or discomfort, you deserve compassionate and respectful care. You deserve a pelvic health care team that's going to listen to you. You deserve everyone that is going to be beneficial to you and that are going to give you the right support. They're going to guide you. They're going to be patient with you so you can feel safe and confident during sexual activity and intimate moments so you can be safe as a sexual being. Again, I do just want to address that penetration is not required for sexual satisfaction. There are other ways that we can enjoy sex without having to participate in penetrative sex. We can do oral sex. We can incorporate sexual toys. We can do different positioning. So I think that you need to, I recommend that you should do what's best for your body. You should do what's best that can support your pleasure, support your healing, support your connection with yourself and with your partner. And as always, I feel like as a society, we are really hard on ourselves and we should practice self-compassion more. We should listen to our bodies more. We should honor our bodies more and ultimately to give ourselves grace because you don't know what you don't know. Initially walking into this, I did not know everything about pelvic floor, pelvic health in general. And throughout my time, throughout my research, I have become sort of like I have some expertise in this now, and I feel very knowledgeable of it. But beforehand, I knew there was a need to know more. I knew it was a need to get this information out there to others, and so I took my time. I gave myself grace, and like even in knowing it, I was realizing like, oh my gosh, like I should have known this. I should have known this, but you don't know what you don't know. So definitely give yourself grace throughout this process, throughout this healing journey. And just remember that pelvic floor dysfunction is common and it is treatable. And you can definitely get the answers with the right support and guidance. You can definitely get the answers that you need. So, you can also pause the video at this time to take a moment to self-reflect and just go into what is one thing that you learned about pelvic health today and what is one question you still have about pelvic health today. So pause the video as needed. And I just want to give a quick shout out to this book. It's called When Sex Hurts, Understanding and Healing Pelvic Pain. It's by a number of authors here. This book it has been a great resource to me throughout my journey of learning more about pelvic health, pelvic floor dysfunction. I feel like this book it talks to like the everyday reader. There's not a lot of like medical terms in here. It doesn't feel very heavy. I think the way the book is laid out, it's perfect for someone who's just trying to understand more, who's trying to increase their knowledge of pelvic health. And so I think everything in this book was thoroughly explained. And I felt like I was able to get answers from this book, get clarity from this book, and even into just like rebuilding and like what are the next steps after realizing like, okay, I may be having symptoms that are consistent with pelvic pain or pelvic floor dysfunction, and what can I do and what does this look like? So I think this book was really affirming and validating for me personally. So yeah, I definitely recommend this book. But if you are interested into a more free resource, at Rise, we will be offering some resources that I have created. I've created some short videos about like how sexual trauma affects pelvic floor, pelvic pain management strategies, some adaptive sexual activity strategies, and then I even go more into like the hypertonic versus hypotonic pelvic muscles. Which I know those may be like big words, but it's more so like what's an overreactive pelvic floor, what is versus an underactive pelvic floor. So that's all clearly explained in some very short videos. And then I also go into, I have some infographics here where we're talking about intimacy. So we're talking about what to do before intimacy, during intimacy, after. I have some positioning. I go into like the lubricants that are evidence-based. I go into like the sex toys to be using, or I recommend using. And then we go into like stress management, self-care, how are we taking care of our body, how are we listening to our body, honoring our body. I have an infographic about like what to do before going to an appointment, a doctor's appointment. What does it look like? What they might be doing? How to create like a pain log or like a pain journal? How do we describe our pain to healthcare providers where like in a way that makes sense to them. I also go into I have 4 pamphlets here about communicating with sexual partners. How do I tell my partner that I'm experiencing pain? How do I tell my partner that I need to stop? Those type of things, and just even outside of sex, how am I still creating this emotional connection, creating this physical connection to my partner outside of sex? I talk about that. I go more in depth about sexual trauma and pelvic floor dysfunction, the impact of sexual trauma. That one also talks a little bit about the overreactive and underactive pelvic floor, and a little bit about what treatment and support may look like. Um, I have one about communicating with healthcare providers, who to go to, what services they provide, what does this process look like, what does this healing journey look like. And then I also have one about pain and symptom management, which is like, how am I describing this pain? So yeah, there's just a wide variety of resources here. They will be available at Women Rise Chicago, which is Ann Rise's website, and in like a PDF format. And then they also will be available on site at Ann Rise in a printed format if you prefer that as well. And so, yeah, this is just a lot of resources. And obviously, you have this video that you can always refer to. So, yeah, while these are all really great, I do just want to recognize that, like, with even I'm covering so many topics here, but this is still just we're just merely scratching the surface. There's still so much more to learn. There's still so much research that's emerging about pelvic health. So, I would just suggest that continue learning. That's really important here. And then I do just want to I have some quick acknowledgments that I want to give out. I want to say thank you to the clinicians, the researchers, and educators whose work has informed my capstone project, my time here at Ann Rise. And I want to thank you to Jennifer Solarte and the Ann Rise community for just a supportive learning space, being able to grow here, being able to show my expertise in pelvic health, and be able to create these products that were well received and very beneficial to the Ann Rise community. And I want to thank my faculty advisor, Dr. Jen Summers, for her continuous support and mentorship, and also just the lived experiences of everyone who are navigating pelvic health, sexual trauma, sexual well-being, definitely with courage. I want to thank everyone who has like guided me throughout this process. So yes, I thank all of you guys so much. Thank you. And then let's see. As we come to a close, if you are interested in connecting with me, my name is Adriana Griffin. Again, by the time you see this, I should be an occupational therapist out of school, hopefully. But my email contact, this is my personal email if you would like to reach out to me. I also have my LinkedIn. It's just my name, Adriana Griffin. And then if you are interested in contacting Ann Rise, this is their website, email information, and also our phone number and our address. And definitely check out online the resources that we have. And these are all of my references. And I thank you guys so much for participating.